All I'm going to do is look at your teeth. Look at your teeth.
At any pediatric dental clinic, there's going to be some tears. This little girl had a tooth pulled a couple of weeks ago, and today she's getting a follow-up checkup, if she'll stop crying.
Well, we got an easy day for you today, okay? You might even get to use my super special toothbrush. How about it?
But it's not all tears and fears at the Ricardo Salinas Pediatric Dental Clinic. Down the hall, another little girl is getting a checkup, and things are going much more smoothly.
See a little bit with that. It's my special mirror, okay? It's real little for real little teeth.
Travis Hildebrand is a first-year pediatric dental resident at the clinic. He says the girl's dental exam went well.
We've been seeing her over a year now. We did one filling on her, and now she looks pretty good. She didn't have any cavities this time.
Hildebrand is learning valuable lessons in dentistry and learning how to work with children, while also providing needed services to San Antonio's west side.
You know, children require a little bit extra attention, and every pediatric dental residency is going to teach you to take this out to the community, to educate parents, help the kids, because people don't really realize, but the healthy habits they develop now usually carry on for a lifetime. So,
a new report by the Centers for Disease Control and Prevention says the rate of preschoolers with cavities has spiked to an alarming 28%. Tooth decay is the leading childhood disease, 5 times more common than asthma and 20 times more common than diabetes. And while it might seem minor, a toothache can be fatal, which recently happened to 12-year-old DeMonte Driver in Prince George County, Maryland. Dr. Philip Hunke, the president of the American Academy of Pediatric Dentistry, explains.
Absolutely tragic. DeMonte Driver died of a brain infection that started with abscessed tooth. An absolute tragedy. Could have been preventable with a $60 or $70 dental procedure and led to this. And it's really caused a lot of stir, and rightfully so.
Over the last 4 years, the Salinas Clinic has been working to provide free or low-cost dental care to children in this economically depressed part of San Antonio, many of whom could not afford dental services otherwise. 85% of these children do not have dental insurance or qualify for Medicaid. Young mother Barbara Cruz says without the clinic, she would not be able to take her 2-year-old daughter to go get treatment.
They show them how to brush their teeth and how to clean their gums. She loves brushing her teeth. Ever since she started coming here, she always wants a toothbrush in her mouth. Even if there's no toothpaste, she wants a toothbrush in her mouth.
This is a great example of how things should work. This nice mommy, she has her child here. This is her second visit, and the child's not 2 years old yet. So what the message is, and what she states to us, is start early, and the little girl has not had any cavities yet.
Dr. Adriana Segura is a professor at the UT Health Science Center and the director of the Ricardo Salinas Clinic. She says the clinic is the product of a unique partnership with the San Antonio Metropolitan Health District, the UT Health Science Center, and the Methodist Healthcare Ministries. And without it, many of these children would not be able to see a dentist.
Families from this community, it would take them 2 buses to get to the Health Science Center. And we targeted, they could not make a 9 o'clock appointment or an 8:30 appointment because taking 2 buses from here, there's no way. So now we have parents that walk from here.
Segura says the clinic sees about 50 children a day, but they never turn away a child who needs immediate treatment.
We book fully, but we always take a toothache. We never turn away a child with a toothache. We get parents calling us. We get nurses from schools around surrounding area. If a child falls or they develop a toothache, they call us and we get them in.
The American Academy of Pediatric Dentistry is meeting in San Antonio this week, and the leadership of the organization is holding up the Salinas Dental Clinic as a model for the nation. And if that model spreads, hopefully the nation won't see any more needless deaths like that of DeMonte Driver. David Martin Davies, Texas Public Radio News.